where the third pair is actually attached to a different chromosome. There's no studies that say which one it attaches to. It's kind of random. So just to give you a visual, that's trisomy 21, so you have the extra pair. And then this is the translocation. So for this one, it's attached to the 14th chromosome. So how does it occur? 95% of the time, it's by maternal material in the oocyte. And it's more or less because they really haven't found out why this happens. It could be because of environmental factors, so toxic substances. Smoking is one of the risk factors because the oxygen doesn't get to the follicle and it stops the maturation. And then right now they're trying to figure out if folic acid has anything to do with it, so they're conducting studies right now, but it's not proven so far. The other 5% of the time, it's by paternal material. They're not sure why it is, but they're doing studies now. And the most common reason why it's a maternal is because it's of older age, over 35 years. They're actually challenging it right now. They're saying that it's not because of age, but that is because they're saying it's because of the higher fertility rates because women are having their menstrual cycle a lot earlier. So, and you might have to do around with the menstruation rather than age. So what are the signs and symptoms? More or less, you can tell by the physical characteristics. So you're going to have this line across the palm. There's a giant gap between the big and the little toes. They have epicanthal folds on their eyes, so they have like little folds over here. They have low-set ears. They have small mouths with protruding tongues. They have short stature, stubby fingers, and usually the back of their head is pretty flat. So they also have, they called it mental retardation, which I call it intellectual disability. And then most commonly affected is the heart and the gastrointestinal tracts. This is more or less because basically their heart is either they have a hole in the ventricles or they have a hole in the atrials. They have tetriocephalate, which is where it's a big opening space. And then the gastrointestinal, because of the short stature, everything's kind of squished in there. So it presents a lot of problems. So how is your lifestyle? The prognosis is pretty good right now because we have a lot of information. We're learning more about it. So as long as they have early intervention, which is from a few weeks old all the way through their life, they can live into their 60s, which is like the median age. And but they're always going to require care, education, compassion. They're going to learn new skills. They're always going to need maintenance throughout their life. And they're actually able to have part-time, full jobs. Some have families, some have children. And they can live independently, but on the more severe cases, they're going to live in like group homes or facilities. So, PT and prevention. This, I found out, is like a really good, it's like one of the most important things for them is PT. So it starts early. PTs will teach them to walk, to crawl, to even turn over when they're babies. That's called early intervention. And then they go through schooling. So there's this thing called Individuals with Disabilities Education Act. And every child that has a disability is entitled to go to school and get this special education. Each one of them is given an IEP, which is an individualized education plan. Because Down syndrome is so individualized, all their symptoms could be mild, severe. Everyone has a different kind of symptoms. So their education plan is going to be on their weaknesses, it's going to be on their strengths, and each one is going to help them maintain their function and then develop further. So because of their, they have hypotonia, so they have weak muscles. So strengthening is a big part of it. They're trying to keep their posture right, they're trying to keep their trunk strong. They're trying to prevent their legs from widening so they can walk better. They can hold themselves upright because most of them have posture problems because of the weak muscles. And they're going to start to like kind of hump, and that's going to mention is the balance ball. You guys ever tried that? It's pretty good. So basically this helps with a lot of things. It helps with strengthening, helps with coordination, it helps with balance, it helps with their motor development. If they're holding on the ball, they're strengthening their core, they're teaching themselves how to like balance and they can walk better. So it's really good. And they have this throughout their life, really. Schooling is the biggest part of them, between the ages of, I would say, from their birth all the way through their teenagehood is like, when they're developing their